USciences Philadelphia College of Pharmacy sent 7 pharmacy students, 4 faculty members to Panajachel, Guatemala. And while we were there, we worked with 2 nurses from the Panajachel clinic, 2 translators, and the director of Woodland Public Charity. And all together as a group, we provided clinical services, health, and education to infants, children, teens, and adults at the Panajachel clinic and also at the elementary school Cerro de Oro.
What surprised me the most was how receptive the patients here at the Panajachel clinic were in receiving our help, and I believe that comes down to the work of past volunteers and also the staff here at the Panajachel clinic.
A memorable patient experience that I had while in Guatemala was with this elderly woman who had come to the clinic where she ended up confiding in me and telling me that she had a parasitic infection. You know, this lady is just walking around like not trying to complain to anyone, you know, just kind of trying to live day by day without acting like there was something wrong with her. You know, she was very strong in her demeanor. It wasn't until I started asking her questions and building some sort of relationship with her that she confided in me. Through that, we were able to figure out what was wrong with her, send her to an exam room, and provide her with the proper medication to get rid of the parasitic infection, which at the end of the day is really such a simple solution. And something as simple as that, you see that they don't have the access to on a daily basis. And it really just opens up your eyes to see how different healthcare is here and how it is in other countries. It's one thing to read about it, but it's another thing to actually sit there and speak to the patients and experience it.
One thing I didn't anticipate on this Guatemala rotation was when the patients came into the clinic, they were wearing nice clothes and they were kind of talking to each other and they were so grateful for everything. And so when we got to deliver the water filters and go and see their homes, I was able to see that in their homes, you know, they're not as well off as they appear by how they're dressed. Maybe they look like they're doing well, but something may be happening to them that you don't see on the surface.
So we don't know like the long-term story of the patient, and we don't know what's going to happen in the future for them. And we also dispense in like smaller quantities to save meds for other patients that come in, and we want to be like as resourceful as possible over here.
As you learn the mannerisms and the struggles that the people are going through here, and definitely today's the last day, and I feel much more confident in being able to help the people here because I have a better understanding of what they're going through.
Keep an open mind, because especially with things that have happened even before going into this rotation, we had to be flexible, and without that trait or characteristic or value, I don't think we all would have had a success in this rotation at all.
It was a pleasure to be the first team from the Philadelphia College of Pharmacy to provide care to the underserved communities of Guatemala. We hope this motivates others to join and take part in this life-changing opportunity.